For student midwives, the support they get is in the clinical area. As a linked tutor, we have 3 different areas we provide to for clinical placements, and from the midwifery team we've got 2 lecturers per each area that support the students. What they have is pastoral support, clinical support and academic support out in the clinical area as well. Academic support for the student midwives will be working with their standards of proficiency logbooks in the clinical area. Pastoral support for student midwives is actually looking at how they settle into the area as well. Those coming from outside of the area, living for university life, do have some complications settling in, and that will extend out into the clinical area as well for their transportation, reimbursement of payments to get to clinical area, practice areas and things. And then the clinical support is that we work with their standards of proficiency competencies and make sure they achieve them and know how they should be achieved. To support the students in the clinical environment, they get allocated a mentor. Now, they are informed as well about mentorship and that they have got the opportunity to work alongside under direct supervision by a mentor who is a midwife working in the clinical area. That person will guide them as to what has to be achieved, what clinical competencies have to be achieved, how to work and how the professional attitude will be working alongside women and care and providing care for them. Quite often in the clinical area we find that the students have specific problems at different times of their training. So a first year student, what she may or he may experience is different to a third year student. In the first year, the students are often faced with working patterns and how to cope with working shifts and how to get used to turning the day around and how to get to their clinical area as well. So in the first year, they don't know what's expected of them as such. They don't know what problems to anticipate. But the main problem for first years will be how to achieve their clinical competencies and how to achieve their clinical assessments that they have to do. In the second year, the student midwives then understand what they're supposed to achieve and how they're supposed to go about that. So we find then that they have more complications working in different areas that would take them outside of midwifery in the programme that is running at the time. In the third year, we have students who have problems doing their clinical assessments because we're making sure they're fit for practice, fit for purpose at the end. So they do a clinical triad assessment. So a lot of them have a lot of stress about that assessment, that type of assessment. So we spend a lot of time supporting and guiding them through how to best get the experience for that and achieve the competencies. Across the clinical areas, all the midwives attend a mentorship programme update, so the mentors are well informed about how to make it successful for students to achieve in the clinical areas. For any student midwife, if she or he was to work very closely, follow the guidance that the mentor gives them, they'll have a range of experiences throughout all the areas that a midwife will be working in. They will get the best out of their mentor, therefore they'll achieve the best out of mentorship.